About 10% of the population worldwide is suffering from chronic renal failure. Now, this is such a common disease, and it can be diagnosed by just 3 simple parameters, which are blood pressure, urine albumin, and serum creatinine levels. Now, we will talk about these in a bit detail ahead. But for now, let's recall chronic renal failure as chronic kidney disease, chronic renal failure, and chronic renal disease. Now, do not get confused, as all of them are the same thing. So I will probably using these terms interchangeably throughout the lecture. However, do keep in mind that these do not occur due to a single disease and may follow several causative factors to establish this condition. Chronic renal failure. Now, it is defined as an abnormally low glomerular filtration rate, or GFR, for more than 3 months. It is a chronic condition, meaning that it develops over a long period of time and it is not reversible. Well, remember that the normal GFR for a healthy kidney is ranging from between 90 to 120 milliliter per minute. And in the case of chronic kidney disease, it may vary differently according to its stages, which we will be discussing further in this lecture. Now, remember that I will be mostly referring to chronic kidney disease as CKD. So keep that in mind. Now, there are numerous disorders that cause CKD, including glomerulonephritis, which occurs in 20% of patients. It is defined as the inflammation of the tiny filters in your kidney, which are the glomeruli. Interstitial nephritis and reflux neuropathy occurs in 15% of patients. Now, interstitial nephritis is a kidney condition that is characterized by the swelling in between the kidney tubules. And reflux neuropathy is a kidney damage due to urine flowing backwards from the bladder towards the kidney. Now, CKD can even occur due to diabetes mellitus in 20% of patients. This occurs because the high levels of sugar in the blood damage the millions of tiny filtering units within each kidney, which were our glomeruli. Now, another reason could be polycystic kidney disease in 10% of patients. Polycystic kidney disease is actually an inherited disorder in which the clusters of cysts develop primarily within your kidneys, causing your kidneys to enlarge and lose function over time. Now, in over 10% of patients, we may also observe renal vascular disease or hypertension. It can be described as high blood pressure that is caused by the narrowing of your arteries that carry blood to your kidneys. Now, obstructive uropathy and a couple of unknown causes are also observed in 15% of patients. Obstructive uropathy occurs when the urine cannot drain through your urinary tract, and so the urine backs up into your kidney and causes it to become swollen. Now, remember that these are the key disorders that result in chronic kidney disease or chronic renal failure. Now, these patients that we talked about who are suffering from these conditions that result in chronic kidney failure, some of them, which is almost 65 to 100 million population per year, are suitable for renal replacement therapy, with 500 per million patients receiving end-stage renal failure treatment. In chronic kidney disease, the normal functions of the kidneys are actually disturbed, which result in 9 possible scenarios, which can be listed as edema, hypertension, accumulation of nitrogenous waste products, uremia, hyperkalemia, anemia. It may even result in renal bone disease, platelet dysfunction, and also can result in different infections. Okay, so we have a picture of these in our minds. Now, let us discuss them one by one and see why do all of these occur. So first up, we have edema. Remember that the failure of regulation of salt and water excretion can result in edema, which can be either peripheral or pulmonary. Or more rarely, fluid depletion may also occur. Now, the failure of concentrating power leads to nocturia, which means urination at night. Then we have hypertension, which is common and occasionally severe enough to cause encephalopathy in chronic kidney disease patients. The premature cardiovascular disease, particularly coronary artery disease, accounts for much of the excess mortality of CRF patients or chronic renal failure patients. Now, hypertension may also relate to dyslipidemia, which means fat in blood, which is commonly found in CRF patients. Chronic anemia, abnormalities of calcium metabolism, and renin-angiotensin system activation is also found in chronic renal failure patients. Accumulation of nitrogenous waste products in the blood may also result due to chronic kidney disease. Now, these metabolic products with a molecular weight of 500 to 2000 daltons, which can be termed as the middle molecules. Now, these produce symptoms that include encephalopathy, high cough, which is an involuntary spasm of the diaphragm, and respiratory organs, with a sudden closure of the glottis and a characteristic gulping sound. Pericarditis may also be observed, which is the inflammation of the pericardium, nausea, vomiting, pruritus, which is itching, malaise, which is weakness, impotence, menstrual irregularities, and mixed motor sensory neuropathy can also be observed as a result of accumulation of nitrogenous waste products in the blood. Uremia, or the urea in blood, causes anorexia and complex disturbances in protein metabolism, resulting in malnutrition, so the maintenance of lean body mass is difficult. Muscle wasting actually causes weakness, inactivity, and further muscle loss. Metabolic acidosis and hyperkalemia are also found in chronic kidney disease patients. These usually are observed due to disturbed homeostasis of potassium inside the glomerulus, which are the tiny filters in the kidney. Now, this imbalance will increase the amount of potassium inside the body. So it leads to metabolic acidosis. That is obviously characterized by an imbalance in the body's acid-base balance. So anemia may also be observed in chronic kidney disease patients. Now, you must be wondering, how is that so? Well, it is mainly because of erythropoietin deficiency. Because erythropoietin is synthesized mainly by the interstitial cells in the capillary bed of the renal cortex. So when the kidney is damaged, so erythropoietin deficiency will be observed. Now, this contributes to a reduced red cell lifespan as well, and occasionally iron deficiency from gastrointestinal bleeding as well. Now, anemia is milder than expected in polycystic kidney disease and can be more severe than expected in the case of diabetes. Okay, so coming to renal bone disease. Now, this can be profound and also disabling, and mostly relates to osteomalacia, which is the failure of renal hydroxylation of vitamin D. May also relate to secondary hyperparathyroidism, which is driven by chronic hypocalcemia that is caused by high phosphate and low vitamin D. Now, adynamic bone disease and nutritional osteoporosis also relate to renal bone disease. Now, this may also lead to aluminum bone toxicity, which may actually complicate hemodialysis. Now, I mentioned earlier that in chronic kidney disease patients, there's an increased bleeding tendency. Now, this is largely because of platelet dysfunction and depressed activity of von Willebrand factor, which is a blood glycoprotein involved in hemostasis. Now, infection is also common in chronic kidney disease patients because immunity is impaired. And the symptoms of chronic kidney disease may have an insidious onset or may present as uremic emergency with life-threatening complications. So that was all for the general introduction of chronic renal failure. Now keep watching as we dive deep to see how chronic kidney disease occurs and how to manage such a situation. So stay tuned.